Hello, everyone. Welcome to this Tech 21 on
cloud-based technology in advancing Senegal's vaccine supply chain. Cette session est présentée en français et
This session is presented in French and interpreted in English. For interpretation, use please
en bas de votre fenêtre, il y a un globe qui indique interprétation.
the block at the bottom of your screen. Click on it and choose English. I'm going to explain it now in English.
Into English. To choose English, please go to the bottom of your window. There's like an interpretation icon with a globe. Click on it and select English. The session is presented in French. La session est présentée en français. Cette session est enregistrée et nous vous partagerons les...
This session is recorded and we will share the slides after the session. Don't hesitate to ask questions during the session. In the bottom of the window, there's a space for question and answer. Choose that Q&A to ask your questions. You can also use chat to discuss, to present yourself. Don't hesitate to introduce yourself, say who you are. If you have a technical problem, please use the chat and I'll be there to help you. I think that's about all. So I'm going to turn the floor over to Dr. Lo. Dr. Lo, you have the floor. Thank you very much, Alex. It's with great pleasure that I'm with you today to present to you, to share with you Senegal's experiment on the impact of the use of new cloud-based technology, helping to improve the supply chain of the expanded vaccination program. My name is Dr. Lo. I'm a pharmacist specializing in vaccination logistics, and I'm also responsible for logistics in Senegal. Without waiting any longer, the content of our presentation is the following: an introduction, a presentation of the vaccine supply chain in Senegal, the implementation of the program for monitoring temperatures with innovative Parsyl technology through the Gavi-infused Parsyl program, but also the implementation of this program at the national level and the results obtained from this program, and also the expansion of the project throughout the country and the various analyses of the temperature data obtained with this project. Then there is question and answer. So, as an introduction, we all know that monitoring the temperature in the vaccine supply chain is part of the evaluation criteria for effective vaccine management. So in Senegal, the technology used to monitor the quality of vaccines includes the vaccine vial monitor, constant temperature recorders at the operational level, but also systems for remote monitoring of cold rooms at the central level and the regional level. Remote temperature monitoring systems must be used to ensure proper practices for storage and transport of vaccines at all levels, and also the availability in real time of temperature data, making it possible to take fast and effective action to avoid loss of vaccines and improve the use of the cold chain. This is why the country, in collaboration with Gavi and Parsyl, introduced an innovative system for remote temperature monitoring of storage and transport at all levels of the supply chain in the framework of its Infuse program. Infuse is a program that consists of introducing new technology that can improve effectively the supply chain of the country. So, the general objective of this project is to improve the conditions of storage and transport of vaccines of the essential program on vaccines in Senegal, but specifically to determine to what extent and under what conditions variations in temperature occur throughout the supply chain. Also, to evaluate the performance of the equipment used in order to strengthen the supply chain, and also to develop in the actors of the supply chain a greater awareness of the sensitivity of vaccines to temperature during storage and transport, and to evaluate current practices and, if necessary, to update the national policy on storage and transport of vaccines. Through the program, the country plans to introduce and use this system at all levels of the supply chain. As for the supply chain in the country, Senegal is a state in West Africa that has 14 medical regions, 79 health districts, and about 1,823 vaccination units, including private sites and hospitals. The vaccine supply chain in Senegal is organized in this way. There's a push model from the central level to regional storehouses, and a pull model between the regions and districts, and between them and health posts, except one region, the Saint Louis region, where the optimized program was tried through the regional supply pharmacy, which distributes vaccines to the service points. As for the information system, we have the SMT, the DVTMT, the DHIS2, but also the system that takes the temperature and stock systems to know the data. This information circuit goes from the service points through the district and the region to reach finally the central level. As for implementation of the program for temperature monitoring with this Parsyl solution, we started with a discovery phase in which we tried this system in 4 regions, 8 health districts, and 24 service points for 3 months. After that phase, we moved to an implementation phase in which we involved all the vaccine units of the health districts of the discovery phase with 169 VUs. That allowed us really to improve the solution. Since after the first discovery phase, there was feedback, there were recommendations from the suppliers, which allowed us to improve the tool and to meet the country's needs. After that phase, we carried out an extension to 63 remaining health districts with 5 VUs in each district. That was in 2019. But unfortunately, after that phase, there was the pandemic, which delayed scaling up in 2021. But meanwhile, there was an evaluation and another external evaluation that allowed us to replicate in all vaccination units and in regional and district storehouses. As for the coverage of this solution across the country during the third phase, we covered the 14 medical regions 100%, the districts 100%, but for vaccination units, it was 53%. As you see on the map, we have 4 regions where coverage was 100%. The regions where we started the program. These were the regions of Dakar, Fatick, Thiès, and Kolda. In these regions, the selection criteria were the size of the population, but also the coverage by the internet network. This allowed us really to see the effectiveness of this solution in the most remote regions of the country with an internet coverage problem. For the other districts in this phase, coverage was from 19 to 50% in health districts. For activities for implementation of this project, 8 trainers had to be trained in the technology at the central level. In turn, they trained 1,408 users in the first 3 phases. 2 supervision activities were executed during the first and second phase. A mid-course evaluation, an external evaluation, whose recommendations made it possible to draw up the plan for scaling up. Installation of the new Parsyl equipment, Trek Pro and Gateway, in the 14 medical regions with training of users. Because at the beginning of the project, the 14 regional storehouses were not linked. We had a system that allowed us to do remote monitoring. But at the end of the contract, we were obliged to continue this remote temperature monitoring with the Parsyl system, which did the same thing as the old system. Then we strengthened the abilities of the district management teams for enrolling all users of the vaccination units throughout the country. We also started installation of new improved systems and replacement of the old ones, which is currently in progress throughout the country. So, for the results of this project, there is monitoring of temperatures done at all levels, from the central level to the service point. Integration of the solution in the Essential Program on Vaccines was easy because it was supported by the high level of training of health agents in vaccine management and the cold chain in vaccination units. There was also the flexibility of the promoter, which was connected with feedback on the ground to improve the solution. There was also the ease of use of the systems, which are Trek. There's also the quality of training on the solution. The technological innovations linked to the youthfulness of most health agents on the ground. Since the new technologies are geared to youth, so we had no program integrating the solution and using this solution with this young personnel. There's also the desire of the program management to advance on the technological level. Besides this project, we have other innovative projects for management of stock and also for management of globalized impact projects. Another result is that the innovative solution induced a positive change of behavior in agents concerning temperature monitoring. That is to say, it was observed that the number of times the equipment door was opened was reduced significantly by taking temperatures by mobile phone. With this solution, it is not necessary to open the door of the equipment to take the temperature. All one has to do is click on the app, the Parsyl app, and see directly the temperature inside the equipment. So the temperature is taken without opening the equipment door. It is also possible to detect and correct quickly problems with the cold chain at all levels. That is to say, this solution allowed us to receive notice by SMS, by email, to warn about problems with the temperature or the cold chain. There are also temperature reading curves that are analyzed, which are generated by the platform and can be used, analyzed, shared, and discussed, and feedback is shared with the vaccination units. Still looking at the results, all the data on the cold chain were in a single place on the Parsyl platform. So if someone wants temperature data, they can be found on the platform. Wherever you are, you can see or download reports on temperature to analyze the data and make a good decision. This platform was accessible and easy to use. It is also possible to monitor the temperature during storage, transport, and vaccination sessions. The supervisor in a district can see remotely the temperature during the vaccination session to follow operations or give alerts on temperature data. There are also incident reports that are written on the platform by certain users, which allowed us to see problems and to transmit information on temperatures. There were also supervisors who use this platform who are notified of alarms and the state of the cold chain and make good decisions based on the data. Also, the needs for supervision training were identified by this platform. Also among results, a reduction of losses in closed vials was observed by users during the external evaluation, but also by the system evaluation, which led to an improvement in the availability of vaccines at the level of the VUs, but also a vaccine coverage by site. However, the quality of the data collected on the ground did not, unfortunately, make it possible to show this with statistics. We do not have the information. As concerns implementation, we faced certain difficulties like the slowness or absence of the internet network in certain places. Also the weakness of the first generation system. At the beginning of the project, systems were used that were not up to date. That allowed us to give feedback to the promoter, which improved its solution. At first, it was a cause of discouragement for some users. There was also the suspension of monitoring activities during the pandemic. For a year and a half, it was not possible to continue monitoring activities to scale up quickly because of this pandemic. There were also refrigerators that broke down, CDF PIS, which were withdrawn. New units were installed in the system because the refrigerators really did not work anymore. So temperature monitoring could not be continued for this equipment. There was also underutilization of truck equipment. It was not used a lot by the users because they noticed that over the course of transport or vaccination, if the accumulators are not well conditioned, there were always sound alarms that caused problems, which meant that some people said, it's useless. I'm going to be delayed by these alarms. But awareness training was done so that they would do better and respect rules about preserving vaccines. The follow-up, as I said before, the follow-up to the external evaluation, the official recommendations of that evaluation allowed the country to move to large-scale operations. The action chosen for this move to large scale was to generalize the solution to all vaccine storehouses, regional, district, and vaccination units. Also, the system used since 2018 will be replaced by an improved system, and the old units will be returned to the central level to be recycled by the supplier. New entities will also be provided with these improved systems. Users will be recycled since they relayed each other during the first, second, and third phases. And new users also will be trained. Post-training supervision is planned to follow up, and also monitoring of implementation will be carried out at all levels. There are clear and precise directives that are available to program supervisors according to level to monitor use of this solution. As for activities of monitoring and evaluation, a plan for monitoring activities has also been drawn up, and monitoring of indicators will be performed, and integration of these indicators in the information bulletin of the program, which is monthly. The reports generated by the program are also going to be used regularly. These monthly reports will also be shared with all actors. For the various analyses of the performance of this solution, the solution constantly evaluates the performance of individual actors. That is to say, solutions are given to a specific structure or a piece of equipment. Regular reports are generated summarizing the performance of the cold chain. It also gives us an overview of the entire cold chain with diagnosis of potential problems with specific units. It can also be personalized according to specific performance measures. As you see, we tried to make an analysis of the performance of 528 refrigerators, with refrigerators that are constantly between +8 and +8 degrees. 78.8% have low temperature variation, and 4.6% with high variation for refrigerators that are constantly between 2 and 8 degrees. But we also noticed that among these 528 refrigerators, there are 32 that are often outside, and 37 often outside the 2 to 8 degree range. And for the 32, the variation was low, but for the 37 refrigerators, 10.6%, the variation was high, which led us to send a maintenance team to see the problem on those sites, but also, at the same time, to replace the refrigerators that gave us a lot of problems. To continue with the different analyses of the performance of equipment used in the solution, this solution also allowed us to analyze the number of high or low alarms recorded by a piece of equipment, and to analyze the performance of types of equipment used in the essential program on vaccinations. Because in the program, there are various kinds of equipment, but thanks to this solution, we tried to modulate their performance, which helped with coordination and orienting the choice of a model of equipment over the course of the rehabilitation of the country's cold chain. And as you see in the graphics, the temperature monitoring curves. The first curve refers to a kind of equipment that was used at the beginning of the project, and what is seen over time is that the temperatures were negative. The supervisor told us about this problem, and therefore they were asked to transfer the vaccines. And as you see above, the temperatures were between +2 and +8 degrees in the equipment where these vaccines were transferred. Afterwards, this equipment was changed, and you see below the temperature curve with the equipment that was replaced, the new equipment that was installed to replace the PIS equipment. That is, the homologue was withdrawn. Again, with this solution, there is the ability to perform an analysis of the cause of underlying problems. Thanks to the information on the platform, it is possible to perform a detailed analysis of problems and action taken for decision making to improve management of the cold chain equipment. And as you see in the pie chart, with the analysis of the problems, it was found that there are refrigerators for which there were temperatures and alarms associated with equipment breakdown, but also problems associated with the door being open frequently, but also cut off of electricity. With this analysis, it was possible to replace electric refrigerators that were on certain sites by solar refrigerators, because in these zones, availability of electricity was very, very low. It was also seen that there were errors in the cold chain equipment, which can be a door that was not properly closed, can also be an interruption of electricity by inattention, etc., etc. That's what I had to share with you. Thank you for your kind attention. And I say again, je redif, thank you. Thank you very much, Dr. Lo. We're going to go to questions. I'm going to ask Suleiman to take the questions. There's one in the section 1 and 2 in the chat. Mr. Geish wanted to know, what is the exact method that allows us to decide the cause of a malfunction of equipment? Are there alarms? What is the alarm system? Dr. Lo? Thank you for this question. With this solution, we have several elements that allow us to have information on the functioning of the equipment. So for the system sends out alarms when there are problems, when the temperature, when the door is opened. The sound alarm goes off. It continues to say there's a problem with the equipment. But outside that, the equipment, on the app, you click and you see there's a problem. There's a change in temperature, or there's a stoppage of the equipment. There are SMS alerts. As soon as there's a change in temperature, it sends a message to say there's a problem with the equipment. It's the ability to have alarms sent by email. So with this system, we not only have sound alarms, we not only have visual alarms, you see a light, a lamp with different colors. If it's not right, and if it's red, we have an idea of the functioning of the equipment. The emails that are sent, depending on their level, don't always automatically transfer data. But most of them There's an internet that makes the transfer automatically, that alerts us to emails that alert us to this. And if there's an alarm on the system of the functionality of the equipment. All right, that's good. You answered well. He wanted to know if the equipment for this are fixed on the refrigerators or are mobile, and if the temperatures are taken during transport and vaccination, or only in the refrigerators. The temperatures are taken during storage and during transfer and vaccination. During storage, it is possible to have automatic transfer of temperature data on the platform to see what is happening on the operational level. And during transport, you can have an idea of the temperature. You can click, not open the door, but simply click on the app and have the temperature of the vaccines for the preservation of the vaccines. So we are able to see the temperature for preserving the vaccines during storage, during transfer, during transport. We don't have to open the door. So you have to use your cell phone. Click on the app and see the information. If the data are transferred automatically with our computer, it's enough to see the temperature. Thank you, Dr. Lo. And he wanted to know the technology that you use. As Dr. Lo said, it's the solution Parsyl. It's called Parsyl. There's the other called Trek. Two systems of Trek. The goal is to have it throughout the supply chain, during storage, during transport.
Et vous suivez ça, enregistre la température de bout en bout.
You put it in your freezer.
Il y a quelqu'un qui demande l'autographe de Parsyl. Je pense que je peux écrire ça sur le chat.
I can write it.
Je pense que Q&A, ouais, c'est... Et M. Yogesh, il demandait température, humidité, pression, quels sont les...
Mr. Auguste asked, what are the parameters of the system for monitoring temperature, humidity, and light?
Bon, je pense qu'on a fait le tour des questions, hein, Dr. Lo.
Well, I think we've gone through the questions, Dr. Lo. Are there other questions for Dr. Lo? Last chance. No other questions? Perfect. We're going to send you an email. Erica Mondefini has a question. A few seconds to formulate her question. Go ahead. Meanwhile, Kirika writes her question. While she's writing her question, we're going to send in information by email, the presentation, the recording. We had some technical problems. We hope to send you the recording. And I'll give an email address in case you have additional questions. So if you want to contact someone, you can do so. Suleiman, the last question. Erica's last question is, did the training of health agents take a long time? This training was done on site. We went on site with the system. How does the system work? We explain how it works. We explain for users the different platforms, applications, the web platform, and let people see the ease. It was training on site. It was a good method that allowed us to have these results. After this training, we did not see changes in temperature. So what was happening? There was a problem with mobile phones. But quickly we can judge. If each morning people can go to the platform and see the problems. If there's a problem for users, there's a good follow-up and monitoring.
Suleiman, je vois qu'il y a encore une dernière question.
Suleiman, there's a last question. She asked if there's an alert system in case of a power outage. Yes, Dr. Lo.
Des alertes SMS.
The system allows to have SMS messages as soon as the electricity goes out. An SMS is sent. If the door is opened, a sound alarm goes off. If the platform doesn't write what happens, we can't know. If there's an alarm, an alert, it's indicated on the platform. That's a practical point. The users want to know what happens in case of an electricity breakdown. If the electricity breaks down, the essential thing is to keep the vaccine safe. The system has an autonomy of 12 hours. So if there's an electricity breakdown, the system can continue to function for 12 hours.
Merci beaucoup à vous deux. Une toute dernière question d'Erika, allez-y.
Last question of Erica. How long does the system battery work? It works for 3 years when you start it.
D'accord, super. Et donc, pour le changement de batterie, comment ça se passe?
And for changing batteries?
On a le souci pour préserver l'environnement, donc on les remplace, on les récupère,
on replace the batteries and keeps them. in our factories. They're recovered. You recycle the batteries. Yes, thank you. Thank you very much. We're at the end of our hour. Thank you much, Dr. Lo. Thank you very much, Suleiman. We wish you a good day and hope to see you again soon. Thank you very much, everyone.
Il est 3 heures du matin maintenant chez Suleiman.
And good night, Suleiman, since it's 3 in the morning there. Thank you for having the courage to get up at 1 in the morning for this. All right, thank you. Goodbye, everyone.